We are the Health and Wellness Center. We are in a very rural area all across eastern Oklahoma.
We started in 2005 from an advocacy group in our community who felt that access to primary care was lacking in our area.
Oklahoma is not ranked very high in healthcare outcomes, whether it be COPD, diabetes, hypertension.
We have lower rates of people accessing dental care in children and in adults.
We have about 31,000 patients.
Patients struggle with a lot of different barriers, and we're here to change that. The patient-centered medical home model, it embodies what we do here at Health and Wellness Center.
Patient-centered medical home, PCMH, is a way to improve healthcare in America by transforming how primary care is organized and delivered. It's comprehensive care, patient-centered, coordinated care with accessible services, quality and safety.
We have 7 medical locations, 2 residential treatment facilities, 3 pharmacies. We have fully integrated behavioral health, dental, optometry, psychiatry.
Morning. I grew up near Stigler. I am married. I have 2 kids. We use almost every service that Health and Wellness provides.
Patient-centered medical home services are wrapped around the patient, whether it be affordable housing or dental care or food.
Transportation is a huge barrier to a lot of our patients. For those patients that can't make it to the Health and Wellness Center, they have access to those services through our community health worker program or our robust telemedicine program.
Hello, Ms. Watson. I'm Dr. McDonald. How are you doing?
Good, how are you?
We've been on this journey to move from a fee-for-service type reimbursement to a value-based outcome reimbursement, really placing an emphasis on what we're delivering in the care system, not how many times we're delivering it. The patient-centered medical home program made us focus on our systems and document how we were closing those gaps.
Being able to provide patients with value-based care improves their quality of life. The PCMH model really opened up the doors for our quality team to improve our quality measures. Our rollout with our new EHR was instrumental in being able to track those patients and improve those patient metrics.
We've been able to see the whole picture of our patient. We know when they go to the emergency room. We know when they see a specialist. Even at a lab draw site, we get a notification.
If we catch the data, then we're able to address the data to take care of the person instead of the symptoms. Then we're able to wrap services around that patient to help them be successful in managing it.
Oklahoma was actually identified as one of 7 states that had increasing HIV numbers. In 2020, we joined the Ending the HIV Epidemic Initiative.
Hi, how are you?
Good, how about you?
The initiative called for testing all patients between the ages of 13 and 65 for HIV at least once in their lifetime.
We really just made it part of their routine care.
We were able to increase our HIV testing rate tenfold in just 1 year. A lot of our HIV positive patients are because of IV drug use. All 7 of our facilities offer medication-assisted treatment and counseling for substance use disorder.
We're community-driven, we're responsive to what our community needs, no matter what that looks like. Head Start is a program that started in 1965 with a mission to close the gap in children that were starting school and children living in poverty specifically.
We were awarded the Head Start program in eastern Oklahoma, serving about 680 kids.
My youngest son, Fisher, he's in our Head Start program. It's not a daycare. Head Start is school. It has structured curriculum. He's getting ready for the public school system.
This is a great place to start healthy habits.
The children in the Head Start program were really lacking dental care.
Dental care is often difficult to access in rural areas, and especially for patients that may be uninsured or underinsured. We are able to take our mobile dental unit to our Head Start locations and provide those checkups and dental exams.
Hi, come on in.
Dental care is really an important component of PCMH because if you don't have that good dental health, you don't have good health overall.
The mobile clinic is definitely a big help for the community.
We're really building our communities as we're providing care to them. Head Start has enabled us to do that by providing a good, safe place for kids to be while their parents are able to work.
It allows me to have that time to be able to have a career here at Health and Wellness.
We employ over 450 community members. A lot of them are patients.
I started in the Patient Access Center in April of 2019, and I've grown since then. I'm now the Patient Access Director, and I'm a part of the leadership team.
The patient-centered medical home model really puts the patient, their families in the driver's seat of their healthcare. If patients have access to the healthcare that they need, they can be productive members of society. They can continue to work. They can continue to care for their loved ones. Having them in a healthier state, whether it be physically or mentally, we're really improving the lives of Oklahomans.